So one of the things that we found is, despite a really good discharge plan and care coordination, we had many patients that were coming back into the hospital because they never followed up with an outpatient provider.
Oh Lord, I got neuropathy in both feet and the left knee from here up. Severe sleep apnea. I've had a heart attack. I got a heart valve. I've been in the hospital twice since I've lived down here with ulcers. If I hadn't met Dr. Barnes, I would have been going in the wrong direction completely. And I feel like that things would have got so bad with infections and stuff that it might have took my life. I'll just put it that simple.
Patients are identified for this clinic that are being discharged from the hospital or from the emergency department. We then see them within 7 days is our target, and are able to help stabilize any medical issues they might have, and then also start to work on education and engagement.
Hello, Dr. Barnes. How you doing today,
Good,
sir?
good to see you.
All right, good to see
How have you been?
sir.
It's meeting the patients where they are, trying to understand what are the barriers for them following through, what are the barriers to them getting medication.
I didn't have no coverage on medications at all because I couldn't afford them out of pocket. They were too high. Insulin, $550 for what I had to have. I didn't have the money for that. If it hadn't been for Dr. Barnes, I wouldn't have got it.
More than half of our patients are self-pay, uninsured patients. And so for a hospital system to decrease uninsured patients utilizing the ER and entering the hospital again, which is a very high cost area to receive care, we're able to really see significant return on investment. For every new patient, we save the system over $2,500. $1.5 million annually of decreased cost to the system. Any problems since you came in last?
Dr. Barnes had referred me to go into a diabetic nutrition clinic, and I've started going to that.
And that transformation that you see where someone shows up and maybe on initial visit, a patient, you can tell they don't want to be here, maybe their family forced them to come, but by the second or third visit, a patient that is totally engaged, that has done everything you've asked them to do, that really has a desire to want to help control their own health, to be able to decrease their need to go to the emergency department.
You've got to follow what to do. I mean, it's hard. I mean, it's an ongoing battle, and I have to do my part. And so I continue to do that.